Hi everyone. Today the topic is altered mental status or acute metabolic encephalopathy, doctor's guide for nurses. So this is just a quick little guide when you have a patient who's confused, who came in confused, or who happened to be maintaining well throughout the day, now all of a sudden became confused. So just kind of a quick guide for nurses to help understand what's going on, as well as when you're calling the doctor, you have a little bit more information and knowledge as to what to convey. Okay, so first things first, always know the patient's history and know the reason for why they're admitted. Okay, these two are super important. And also, just, their medications, home medication. Okay, very important to know. Okay, anyways, let's get into it. So, metabolic reasons for confusion, infection. So, infections, fever. So, anytime anyone comes in or all of a sudden they're starting to get fevers, they become a little bit confused. Always think of infection, right? There's septic encephalopathy. You can think of that, meningitis, fevers, so that can cause confusion. Next is dehydration. So with dehydration, just in your physical exam, look at their skin turgor, check their blood pressure. Is their blood pressure low? Check capillary refills, look at their lips. Are their lips dry? So these are tell signs of dehydration, can also cause confusion. Next is electrolyte imbalance. Electrolyte imbalance, I like to think of sodium and calcium, okay? When you have low sodium or high sodium, those are risk for confusion. Same thing with high calcium. That is, a risk for confusion. So if you have someone who's confused, look at their sodium, look at their calcium. Are they normal? Next is acidosis. So with acidosis, I always look at the pH and always look at the bicarb to see, are they acidotic, an anion gap. You can also look at usually things like DKA, patients are confused, okay? COPD, they're acidotic, they're confused. So, hypoxia, when they are not really breathing and now their pH is dropping, for example, So these are all causes of confusion. Infection, sepsis, kind of already went over. The typical scenario is geriatric patient comes in, they're confused, you do UA and you see that they have a UTI. So that can cause confusion, infection. There's also bacteremia, there's the UTI, there's pneumonia. Okay, so multiple causes of this. Next is organ dysfunction. So organ dysfunction, you think of cirrhosis, you think of renal failure. Are they ESRD? They need maybe dialysis. Okay, liver cirrhosis. We'll get more into that in a little bit. Poor nutrition, the thiamine deficiency. You think of Wernicke's, B12. These also can cause confusion. Hypoglycemia. This should be the first thing you should be checking. Is their blood glucose? If they're confused, just check the blood glucose because that is an easy fix. Okay. Next is hypothyroid and hyperthyroid. Are they taking their medications? Review their med list, okay? Check their home med list. Are they supposed to be on medication for their thyroid? Adrenal insufficiency. Did they recently get off of steroids and now all of a sudden, their blood pressure's low, they're confused. Okay, now let's move on to toxin medications. There's a lot of medications that can cause altered mental status. Like digoxin can cause confusion, especially if they have renal failure, or cephalosporins can cause confusion in the geriatric population. Illicit drugs, so you have your PCP, you have your meth, you have your cocaine, that can cause confusion. Alcohol withdrawal is a big one, okay? Someone comes in, let's say for a knee replacement, and now it's been they had to stay a bit longer for whatever reason, and now all of a sudden they're tachycardic, they're diaphoretic, they're confused. Maybe they're going through withdrawals. Uremia, again. Someone who is, ESRD, or maybe a new onset renal failure. And, they're confused, they're not able to clear out their toxins. Cirrhosis. So cirrhosis, again, you want to check ammonia level. check ammonia level, or, know to check ammonia level if they have cirrhosis. If it's elevated, you could give lactulose or rifaximin. Sorry, I can't spell. If they're ESRD again, did they get maybe morphine, or were they getting insulin and now their blood sugar's low, or maybe they need Narcan because, you weren't able to clear out the metabolites. Okay, hypertension can cause confusion. So there's such thing as hypertension encephalopathy. Okay, this is a diagnosis of exclusion, but someone who has a really, really high blood pressure and they're confused, and all of a sudden you're able to bring it down. Now they're maintaining better. This could be the reason. Seizures, obviously, that they're going to be confused. Post-ictal shock. There's so many different type of shocks. Distributive shock. There's anaphylactic shock. No, is this the reason why they're confused? Let's say they have a GI bleed and they're losing their hemoglobin, right? So that means low perfusion to the brain. Now they're confused, okay? Heart failure. Heart failure is low perfusion to the brain as well. Stroke. Stroke, okay, big deal about stroke. So let's talk about stroke real quick. So let's say your patient is fine. Now all of a sudden, they are slur speech, right? Slurred speech, unequal pupils. Always, please check pupil, guys. Always check pupil of any reasons why they're confused. Just check the pupils, okay? Slurred speech, dysphagia, unequal weakness, extremities, okay, drooping. These are all signs of stroke. Call a stroke alert if your hospital has that, okay? And then lastly, sundowning. Sundowning, usually it's some interesting phenomenon that you see during the evening time in the geriatric population. But make sure you rule out everything else before you call it sundowning, okay? So the reason why I wanted to go over this with you guys is if you have a confused patient, number one, check blood sugar. That is one thing always I say, check blood sugar. Make sure you look at their history really quick, okay? Maybe they need to be on seizure meds and they're not, and that's probably the reason why they seized. Now they're confused, okay? Or maybe they have a history of alcohol abuse and you notice, they're going through withdrawals, so now you know their history. Then you want to know why they're admitted. Maybe they're admitted for pneumonia, okay? And they're confused, okay? So we see maybe it's the pneumonia, but let's rule out other things. And then always look at their home meds. Always quickly just kind of go over their home meds too, okay? All right, guys, I hope this helped you guys. If there are other topics you want me to cover quick and straight to the point, please leave in the comment below and I will do my best to make videos for you. Okay, thank you so much. I also have an ebook for rapid response. Link is below. Thank you so much for your time. Healthcare workers, nurses, you guys are the best and I love working with you guys. We're such a team together, physicians and nurses. Let's make that bond strong and do the best we can and help our patients, okay? Thanks and God bless.